is captioned with saying, "I recommend you cut back on red meat." So would you trust this guy for weight loss advice? And then second question, would you trust this guy for hair loss advice? And then here's I believe what we referred to as a straw man argument that he posted on his social media, picture of a obese physician who is captioned with saying, "I recommend you cut back on red meat." So would you trust this guy for weight loss advice? And then second question, would you trust this guy for hair loss advice?
Yeah. For weight loss advice, I would ask myself a few different questions. What's this individual's history? Perhaps he used to be much more obese than he actually is. There's a slim chance, 1 in a million, that he has a genetic cause of obesity, of hyperphagia or Bardet-Biedl syndrome. And maybe that's why he went into obesity medicine. That being said, that's probably not the case. And I, frankly, probably wouldn't trust that individual as much for especially exercise advice, but probably not diet advice. And then the straw man argument, of course, would be that all doctors tell you to cut back on red meat, whereas at least physicians who are recently trained are trained to, especially if they're trained in obesity medicine, to cut back on the calories that you intake and increase the calories that you expend.
Yeah, so this physician may provide you the accurate advice. Hey, you need to exercise more and eat less, come back and see me in 6 months. Or maybe they prescribe you a medication for weight loss, but it's not necessarily incorrect information. It's just going to be the patient's perception of the value and the quality of that information. Mm-hmm. So if you have someone who regularly exercises, you may open a dialogue with the patient where it's like, well, what do you do? And I think that's an okay situation. You don't want to impose your personal lifestyle, exercise habits, diet, supplements, everything like that on a patient. But you can give examples of, well, I do this, and some people like to do this. There's a lot of different ways to do it. It's about finding something that you enjoy, or finding the least bad option. So, if I go tell everyone to go run hill sprints, some people are going to get healthier from that. Some people are going to hate it and quit, and some people are going to get injured. So I don't tend to recommend hill sprints universally, even though it's a way to increase calorie expenditure, so it should work for weight loss. Mm-hmm.
It's almost like you're trying to say that individualized medicine and having each unique person have their own regimen is superior. But it doesn't make sense, because when you go outside of our evil conventional health system that goes through insurance, isn't 98% of that just healthcare providers imposing their exact algorithm that worked for them and the exact medications and supplements that worked for them on all of their patients?
If there was a Venn diagram of providers outside of the traditional healthcare system and healthcare providers that are imposing what worked for them on patients, it wouldn't be a perfect circle, but it would be pretty close.
Mm-hmm. If you go to your endocrinologist and they happen to be a type 1 diabetic, you'll probably be put on the same regimen that he or she is on. If you go to a men's health clinic or a urologist and you happen to be put on a regimen, you're probably on the same regimen that he is on, or she, if it's a women's health clinic. Mm-hmm. If it's an OB-GYN that previously was very against hormone replacement therapy, and she went through menopause, or he went through andropause. Let's be fair here.
Sure.
And they leave the hospital system and their group that they're working with, and they start a regimen. You'll probably be prescribed what he or what she is on. And I'm not saying this to be negative. It's just a fact. We see this all the time.
Yeah. And people build multi-million-dollar health systems strictly around the carnivore diet or X supplement or intermittent fasting. And there's really no secret. They just tell people to do this one thing and it's going to work for them. And for some people, that's a positive catalyst and they do become healthier. For other people, it doesn't work and they don't stay plugged into that system, I would imagine.
It's like a fake natty equivalent of it being a healthcare provider. To be a fitness influencer, you take a bunch of steroids or SARMs and you tell people it's this program just buy my program and you need to do this mesocycle and deload like this, and then you'll look like me. But in healthcare, they say, well, you need to buy my diet program. But in reality, you should be getting their exercise program because that's what's really giving their results.
Is that why people say that eating healthy is expensive? Because you have to pay for an expensive diet program before you even get any food?
Yeah, I guess so. And in some ways, and it's not eating healthy that's expensive, but it might be shopping at Whole Foods that's expensive, especially if you're buying processed foods at Whole Foods.
Well, I buy my legumes from Trader Joe's, and they are less than $4 for I think it's at least a pound of pre-cooked legumes, so it's convenient. Just because it is processed and pre-cooked and ready to eat doesn't mean that it's necessarily unhealthy.
Yeah. And we've done a podcast on this before. So see our previous podcast about the different costs of foods. People know that I like to go to Aldi and I like to eat potatoes, spinach, Greek yogurt from there.
Absolutely.